Bipolar and related disorders. Why these colors? So, this is the colors we feel. A new study finds people tend to pick different colors to describe different moods, and they pick yet and other colors as their favorites, regardless of the mood they're in. The results are not across the board, but represent tendencies among those tested. Other moods, conditions, and colors remain to be tested. So best described mood of anxious and depressed people tend to be between 34 and 37 up here. Hold on. Up here, 34 to 37. So it's kind of your dark grays to light gray, I guess. Light blue here is favored among healthy people. This slightly darker blue is favored among anxious and depressed people. And the yellow here is the best described mood of healthy people. So even though the light blue is their favorite, the yellow is how they describe how they feel. Which, this is just interesting. General information. Bipolar and related disorders are separate from the depressive disorders and placed between the chapters on schizophrenia spectrum and depressive disorders, to acknowledge the bridge between the two diagnosis classes in terms of symptomology, family history, and genetics. Bipolar 1 represents a greater understanding of manic depressive disorder of the 19th century. A majority of individuals whose symptoms meet criteria for full syndromal manic episodes may also meet major depressive during the course of their life. Bipolar 2 requires a lifetime experience of at least one episode of a major depressive and at least one hypomanic episode. This disorder is also accompanied with serious impairment in work and social functioning. Cyclothematic is given to adults with at least 2 years of both hypomanic and depressive periods, without fully meeting criteria for mania, hypomania, or major depressive. Bipolar 1 diagnostic features. Manic episodes is a distinct period during which there is an abnormally persistent, elevated, expansive, and irritable mood, and persistently increased activity or energy that is present most of the day, nearly every day for a period of at least 1 week, accompanied by at least 3 symptoms in criterion B. Mood in a manic disorder is often described as euphoric, excessively cheerful, high, or feeling on top of the world. This mood can be infectious and desirable. During a manic episode, a person may be engaged in multiple projects at one time. Other presenting features may be inflated self-esteem, decreased need for sleep, speech may be rapid, pressured, loud, and difficult to interrupt. Thoughts may be racing so rapid that they cannot express themselves. Increase in goal-directed activity, expansive mood, excessive optimism, grandiosity, and poor judgment, often leading to reckless involvement. Other features. Individuals often do not perceive illness of need for treatment during manic episode. Individuals may change features about themselves like dress, sexual activity, amount of makeup used, sensitivity to smell, hearing, or vision. May include rapid cycling, which lowers prognosis. Mean age of onset is roughly 18 years. Suicide risk rate is 15 times higher than the general population. So, and they also have a high rate of lethality. Comorbidity is very common, usually substances. However, many individuals also have medical conditions such as migraines and metabolic syndromes. Bipolar 2, recurring mood episodes with one or more major depressive episodes must be at least 2 weeks, and at least one hypomanic episode must be at least 4 days. Common feature is impulsivity, which increases suicide attempts. 33% of individuals attempt suicide, however, lower rate of lethality. The average age is 20. Comorbidity is often associated with anxiety disorders. In fact, 60% have 3 or more mental disorders. It's what I can't pronounce a lot. Clythomenic is often chronic, fluctuating mood disturbances involving numerous of hypomania and distinct depressive episodes. Onset is often adolescence or early adulthood, often accompanied with sleep disturbance and substance abuse as comorbidity. Genetic factors. Often genetic factors may influence the age of onset. Secondly, more pronounced in first generational. The genetic component is often one of the strongest and more consistent risk factors. Interestingly enough, bipolar 1 is higher among high-income families. Therefore, environmental factors key. Depressive disorders. The changes in this section have become more detailed as more has been discovered and researched from the previous DSMs. Personal and professional cautions. I work at a psychiatric rehabilitation unit as a clinical social worker. In this role, I conduct screenings for depression for specific medical conditions. We use a nationally accepted tool. There are several tools that will assist you in understanding the diagnosis and offer insight to individuals you are working with. Most important to note that some medical conditions and treatments cause depression. For example, cardiac patients with beta blockers have a higher likelihood of developing depression symptoms, like symptoms, stroke patients, alcoholism, etc. Some tools are Beck Depression Screening, Hamilton, PHQ-9, etc. Try one of these with your movie. This is for my class that I have to watch movies for. I'm not watching one on depression though. Depressive disorders. There are common characteristics: presence of sadness, empty, irritability, accompanied by some somnatic and cognitive changes significantly affect a person's capability to function. Differences between disorders in duration, timing, and presumed capacity. New diagnosis: disruptive mood dysregulation disorder for children, which includes persistent irritability and frequent extreme behavioral discontrol. So this is up to age 12. Classic duration is 2 weeks. Bereavement tends to cause great suffering, but does not tend to induce a true episode of major depression. Premenstrual dysphoric disorder has been moved from the research in previous DSM. After 20 years of research, a form of depression that begins following ovulation and remits within a few days of menses and marked impact on function. Persistent depressive disorder, used to be called dysthymia in the DSM-4, is the diagnosis when the depression is chronic and persistent for 2 years. So major depressive disorder, disruptive mood dysregulation disorder, onset prior to 10 years. Major depressive disorder means most of the days, hours, and most days. Often involves a sleep disruption / energy level. You must assess previous patterns. Loss of interest or pleasure, withdrawal or neglect may include activities of daily living, appetite changes, psychomotor changes, so speech, body movement, and thinking, and thoughts of dying or death. High mortality by suicide. There is an increase of wishes of death within 1 year of entering a nursing facility. Please make sure to read and understand diagnostic criteria, as this is a diagnosis that many U.S. adults carry. Chronic or disabling medical conditions may increase the risk factors: diabetes, morbid obesity, and cardiovascular disease. Please note there are several more medical conditions that they are not listed in the DSM-5, such as eating disorders and food allergies restrictions, cancer treatments, sleep conditions, pulmonary conditions, just to note others. Another caution is sadness. There are inherent situations in human experience that reflect periods of sadness. Make sure the sadness is not equated with depression unless it truly reflects the diagnostic criteria of severity, duration, and clinical distress or impairment. Persistent depressive disorder was dysthymia. Make sure you are aware of the diagnostic criteria. Also, you need to note the specifics with blank, remission blank, onset blank, persistent for 2 years, and severity. Persistent depressive disorder particularly notes 2 years for adults and 1 year for children. Premenstrual dysphoric disorder, obviously a woman's disorder with a prevalence in about 1.8 to 5.8% of the population. Substance/medication-induced depressive disorder. In my opinion, this occurs more frequently than we are diagnosis. For example, many beta blockers, primarily used for heart conditions, cause depression. Sedatives may cause depression. Alcohol is a depressant. Depressive disorder due to another medical condition. Again, depression may be the unintended consequence of some medical conditions. For example, stroke patients have a higher likelihood to have depression while recovering. The basket is unspecified depressive disorder. This is where all others will fall. If an individual does not fully meet all the criteria, look here. So with anxious distress, with mixed features, symptoms of mania, with melancholic features, so lack of interest, sleep issues, weight changes, with psychotic features, catatonia, with peripartum, so with pregnancy or postpartum features, with seasonal patterns, seasonal affective disorder. This is an issue for individuals living above the 47th parallel. Seasonal affective disorder has been undiagnosed in such areas as Maine, New Hampshire, Alaska, and Canada. Its elimination is due to concentrated living areas and explained by medical treatment of diet, light, and medication.